Well, thank you. Thank you so much for all of you who are taking the time to register and actually follow my instruction to come online for the second virtual, let's say I got this right, Midwest AANHPI Health Service Summit. And thank you. So I just want to also let you know, this is being recorded for two purposes. One, for us to make sure we check all the conversation action item. Second, Dragon Eagle is going to broadcast this at a later time to her audience, most likely the what we call prime time, later today or next couple of days. So whatever you say will be shared among a lot of people. So behave yourself, George. Yes, I will. Okay, and one thing I want to open with is that the founder of Midwest Asian Health Association, Dr. Hong Lu, Joe Ling, and many others, have this vision of having the organization to help achieve equity for Asian American community many years ago. And because of that, they have continued to be very successful in not only in Chicago, where their base is, and also in spanning Illinois in different suburbs. But now they're really taking very strategic direction on helping achieve that goal in the Midwest. As part of that, we as a team put together a 5-year plan, which 5-year strategic plan include the creation of this summit and also possible creation of the Midwest AANHPI Health Coalition. And we all know that this is a good idea, but somebody's got to do the work. And because of the coalition's concept, and I'll talk a little bit more about that, Dr. Hong Lu had agreed to put together sort of like an open conversation. And this is very difficult. Open conversation, seek out insight and advice. And actually our follow-up is going to be bringing smaller groups together in a closed meeting. But we want the first conversation to be more open conversation, get in from everyone, and enlist the support of people. People meaning folks from the government, folks from the foundation, folks from education institution, and most importantly, other Asian health advocacy organizations in the Midwest. And strategically, we have selected and invited a few people from outside of Illinois because so to make sure we get as much as a diverse input. And you see that we have a pretty good list of speakers. So what I want to do is really just run through the agenda real fast. We'll try to make it as informal as possible so to encourage conversation. But I think it'll be good for me to put the context in and make sure we are in good shape. So I want everybody to know, please mute when you're not talking. When you're asked to talk, please unmute. And you could chat, use the chat group to connect with other folks on the call and make that connection. And we could also facilitate connection if you want to get to know certain people. Quickly, we got some open remarks, some VIP remarks. I want to spend a few minutes talking about the potential of creating this health service coalition. We have two panel, one national regional perspective, one is community advocacy, and I'd like to reserve a little bit of time for an open conversation. So we have two MAHA executive and leaders to share their thoughts. Joe Ling, President, Dr. Hong Lu, and this is some highlight from MAHA. We'll use that. And I'm very excited to have Michael Adele, strong supporter of Asian community, And actually, we are starting to have a lot more conversation around health. Obviously, Michael is HSS, so that's a way perfect match in the conversation. And the two panel, we want to have a more dialogue. So we're going to ask each individual panelist to share their thoughts. We're going to have me talking with the first panel, and we have to pull Juliet off this panel into an earlier stage. So there should be, and we have the conversation already. I asked her the question that she want to address as she's in the panel, and she's going to do that. And then we're going to have Ann Starr lead a conversation with the advocacy organization leaders. Okay? And we're going to have open conversation, some closing remarks. So that's the agenda. Any questions? No, if not, I'm going to push forward. And I asked Zhongling, president of the MAHA board, to say a few words to welcome. Let me see how many people, Zhongling.
How many?
I don't know. I lost track. I can't count that fast.
69
total.
69. Oh my goodness.
Oh wait,
but we did expand it to wishful thinking, 500 maximum. So we should be okay. We have 140 people registered. Anyway, go ahead.
Oh, George, thank you. Thank you for that preparation and the brief introduction of this virtual meeting. And thank you for organizing all this. And today I'm so nervous because Dragon Eagle TV is broadcasting. So want to make sure everything I say is carefully chosen. Okay. Good afternoon, everybody. I am Zhongling Liu, the president of MAHA board. On behalf of MAHA, I would like to welcome you all taking part in the second virtual Midwest Health Service Summit and join the discussion of how we together can establish more programs and advocate more government policies to help the medically underserved low-income populations in the Midwest. Through joint efforts, ideas, and knowledge, we can explore more ways to establish a Midwest AANHPI health coalition to serve more people in need with MAHA. AI can never replace love. AI cannot read people's mind. We, healthcare service providers, organizers, and individuals, are irreplaceable. Let us continue to work harder, and please enjoy the following panels and discussions. Thank you. Thank you so much.
George, you mute. George, you mute yourself.
Yeah. Okay, Zhongling, I just want to let you know.
Yes.
AI will replace me.
I don't think so. You are unique, George Moy.
I don't know. Unique is a funny word. But next, I want to invite Dr. Hong Liu, one of the founders, and current executive director for MAHA.
Thank you. Can everybody hear me?
Yes.
Good afternoon. Yes. Welcome and thank you so much for attending the second Midwest AANHPI Health Service Summit. My name again is Hong Liu. I'm the founding member and the executive director of the Midwest Asian Health Association, we call MAHA. First, of course, I always want to advertise for our organization. So I want to take this opportunity to provide an overview of MAHA, which is a non-for-profit community-based organization established in 2003 with a mission to reduce health disparities among medically underserved and low-income populations by providing culturally sensitive and linguistically appropriate services in collaboration with public health organizations, healthcare providers, government agencies, academic institutions, and community-based organizations. We are located in South Chinatown of Chicago with additional 3 sites serving different community areas. MAHA is the first Asian Family Advocacy Center in Illinois and the first food pantry center in Chinatown starting this year. We have a state licensed mental health clinic and the first substance use clinic in the Asian community in the south side of Chicago. Our employment program provides services to people with mental health and other disabilities. Our Navigator program has served thousands of people for health insurance and other benefits applications. We have a health screening, immunization, and a patient care program in collaboration with Chicago Department of Public Health. With a free hepatitis B clinic, we identify and treat hundreds of patients with hepatitis B and liver diseases. We also serve youth through our Youth Summer Youth Program and the Summer Employment Program. We were just notified last week that MAHA is awarded a $1 million grant from the Cook County Health System to implement a mental health program in Cook County, Illinois. MAHA's bilingual and bicultural staff team has been working very hard with partners to reach and engage the most vulnerable populations in Chicago, the Midwest, and beyond. We are so pleased to host this second summit to advocate for partnerships and resources to address the Asian health issues and the services gap in our communities. Thanks to George Moy for putting this event together. It is our hope that this summit will lead to further collaboration throughout the Midwest, leading to the creation of a Midwest AANHPI Health Coalition. It is my pleasure again to welcome you and look forward to a great program presentation next. Stay with us. Thank you.
Thank you. Okay, next in line we have Michael. This is your turn this time. Don't forget you're on TV.
Hey, George, thanks for having me. And I want to thank you again to MAHA for sponsoring the second annual Virtual Midwest AANHPI Health Summit. And also thank you to all the organizers and the people for being here. And also thank you for all the front.
Are you still
Michael?
there, Michael?
We lost
Michael is driving too fast, I think.
Well, I can jump in if you want me to, George.
Yeah, let's do that. Well, we have. Let me do a real quick introduction.
Okay.
Adele Webport, is that how you
Rapport.
pronounce it?
Yeah.
Report. She's actually the director of the Federal Executive Board in Chicago. She served in the front of the Asian community for quite a few years now to help us with many different programs. So your turn.
Okay. So I'm the chair of the Federal Executive Board, and that's basically all of the federal executive agencies, in the Chicagoland area. And most of us have, we have other states, so it's a Midwestern coalition. This was a Federal Executive Board was established by President Kennedy in 1961 because most federal employees are outside of the Beltway, and he wanted to coordinate, the efforts of federal agencies to better serve, the local citizens. So we have about 55,000 federal employees. We're the largest employer in the Chicagoland area, 178 federal agencies in 12 counties. And I just wanted to talk a little bit about what we've been doing with the Asian American community with George's help, because he always sends out the invitations that I send him for various events. So I'm also on Region 5 of the White House Initiative of Asian American, Native Hawaiian, and Pacific Islanders, as is Michael Carbonaggi. And so we've been doing, the Federal Executive Board has been doing joint programming with AANHPI. We did an economics and education summits in connection with the Lunar New Year in February of 2023. And then, I really pushed Doug Nguyen from Social Security to do a program in Milwaukee with the Hmong community. So we went to Milwaukee and we did a roundtable. We had about 50 people there, and many people were from the healthcare industry that were talking to us about various benefits. We had regional directors. Michael was there. He was one of our keynotes. People from Social Security, people from Department of Justice. We have people involved who are involved with ERISA benefits, the Department of Labor. So that was a very successful event in September. And then Doug did a program in Ohio, a community roundtable in Cleveland, and he did it in the part of the community, it was Chinatown, where they'd lost a lot of businesses and wanted to do an economic shot there. They had about 200 people attend in this roundtable which was sponsored by Region 5 AANHPI. And we had people from the federal executive board there as well. On June 7th, I sent George an invitation. We had Women in International Trade. And we had a seminar that was co-sponsored, by the Federal Executive Board and Customs and Border Protection. We're probably going to do that again next year because we had about 200 people, and that was very successful. And then the White House Initiative on Asian American, Native Hawaiian, and Pacific Islanders is doing an economic summit in St. Paul, Minnesota, on July 2nd. There'll be a small business track and a community track, and the President's Advisory Commission will be doing a listening session in St. Paul. So that's primarily, I've been working with the Hmong community because I have Minnesota in my jurisdiction, and we've been working closely with them. So I just wanted to say that the Federal Executive Board is here to serve the Asian American community. We really enjoy co-sponsoring and appearing at events to let them know we're open for business, and we have many healthcare agencies that, may be able to assist you. So thanks. That's all I wanted to say. And I guess if you can get Michael back, he's much
Michael,
more
it's
interesting than I
perfect
am.
timing. You good? Michael, are you not driving too fast, are you?
So I apologize, everyone. I am driving in rural Wisconsin right now. I've got an event with Secretary Javier Becerra, the Secretary of HHS, and Chair Whitehouse, the Chair of the Domestic Policy Council near Tandon in beautiful Wisconsin Rapids, Wisconsin, outside of Green Bay. So I apologize. Listen,
No worries.
I have a little bit to add to what Adele said, but Adele really knocked it out of the park. So since they took office, the Biden administration is really focused on equity and justice for AANHPI community. And Adele mentioned, you see it in WIAPI. Last February, we had a meeting of the WIAPI Board of Commissioners in Chicago, and then an economic summit. Adele mentioned we did it last month again in Cleveland, and then in St. Paul, we're going up July 1st and 2nd for the same, a meeting of the commissioners there, and then we do a series of resource fairs and panels. Can't emphasize enough, those are a result of what folks are telling us they want. We bring in HUD to talk about housing. We bring in the Department of Commerce and the Economic Development Administration and the SBA to talk about loans that are available to AANHPI communities. Talk about how you can scale up your business and get that next level of credit that you might need to grow your business. And at HHS, and that's really why we're excited to be here today with Maha, we want to talk about what we're doing to uplift health access and health equity for the AANHPI community. As President Biden always says, we meet people where they are, but we don't leave them there. And we realize that there's a lot of historical inequities that the AANHPI communities have to deal with in terms of access to healthcare, access to affordable healthcare, and access to culturally competent healthcare. And that's one of the things I think that Maha is leading on, is realizing that whether it's mental health, primary care, public health, substance use disorder, child care, elder care, the needs of the AANHPI community are unique, and they need to be addressed that way. And we're looking forward to being partners with that. So again, George, thanks for bringing us all together again. Apologies for my technical difficulties. I'm very excited. Rachel Wynn of our office is going to be serving on the next panel. Rachel is really a superstar. She just 2 weeks ago graduated from the University of Chicago with her MBA and her master's in public policy. And her background is she spent 5 years being a consultant in the elder care space for working with elder care facilities to help them be the best that they can be. So I think she's going to bring a really valuable perspective to the conversation. So again, thank you to Maha for putting this together and for inviting us. We appreciate it.
Well, thank you, Michael. I know you could easily said, George, I'm traveling with a secretary, and that'll be the end of our conversation. But you took the time. And,
George, I get guilt from you that AI could never give me.
All right, thank you so much.
Thank you.
Adele, I do want to say thank you to you because I spent a couple of years with the White House Initiative with a lot of appointees, and that comes through every administration. But what I find doing that job is the anchor, the core of the federal government in terms of sustainable continuation program is really through the Federal Executive Board and your directive to your agency. So I really appreciate you taking I know a lot of time working with me and quite a few others in doing this community outreach for the Asian community. Just one question for you, since I'm playing the role of moderator. We haven't had a chance to have this conversation. I'm kind of putting you on the spot. What are your thoughts on a Midwest Asian American Health Coalition?
Well, I think it's a great idea. Actually, my daughter-in-law, Erlene Cuisan Seymour, is a medical director for a drug company, and she has been doing research academically. And the subject of her research is access to care. And that's the access. And so I've talked to her a lot about that, about how important it is to have culturally competent access to care, and how that affects outcomes. It couldn't be more important, to make sure that we have local agencies that are guaranteeing access to care in a manner that meets the needs of the community, so that you can affect outcomes. I mean, there's nothing more pragmatic than that. So I'm just, I couldn't say no to this.
Well, you'll be hearing from me quite a bit more.
Right.
Yeah, you know that already, but.
Right.
Yeah, this is great. This is great. The idea of, and I know we're a community used to VIP like yourself come in, gave a talk, and I don't see you for another year. But you've been to almost every one of the community events that at least I organize. So I appreciate it. I know you're busy wearing multiple roles. And you're also part of the Department of Education.
We spread out
Right,
a little
Office
bit
for Civil
everybody
Rights.
brings them.
So we do civil rights enforcement, and we don't get enough complaints from the Asian American community about discrimination in schools. And so that's one of the things that George has given me platforms for, to talk about getting people to be brave enough to come forward and file complaints about bullying and harassment in the schools.
Well,
that affects mental health too.
So and I are trying.
Yeah.
How to get people to step up and say, hey, there's a problem here. Right, Ann? So we'll be talking to you about that particular topic. Well, with that, I want to push on and thank you so much. You're welcome to stay and
thank you.
Participate in the open conversation, of course.
Okay.
I'm looking
I
for
have to leave.
Julia Choi. She's on a very fast schedule. And can somebody help me look for her as she come on?
She's here.
She's here. Where is
Yeah.
she?
She's here.
Julia.
Hi there.
Where are you?
She's
Where are you?
probably on the second page, but it's the front page with me in the middle.
Oh, there she is. There she is. My friend, how are you?
Really good, really good. Thanks, George.
So I know you have a very heavy schedule and couldn't participate in the panel. So we offer you a few minutes here to share your thoughts and a little more about your organization.
Great. Thank you so much for this wonderful convening. And my goodness, congratulations and thank you for everybody who's taking time to share their afternoon this afternoon. And Zheng Lang, it's wonderful to see you virtually. Dr. Hung Lu, it's great to see you. I've had the chance to see many of you in Washington, D.C. last year. And then earlier this year, I was just really honored and privileged to have the chance to visit with Maha in Chicago. So thank you for sharing a few minutes of your time with me. I know how incredibly busy each and every one of you are. If you're not familiar with the Asian and Pacific Islander American Health Forum, call us the Health Forum for short. We are one of the oldest and largest health justice advocacy organizations for the Asian American, Native Hawaiian, Pacific Islander communities. We're almost 40 years old, and we really do our work to advance health equity, but also visibility of our communities in at least two core basic ways. Number one, I'm based here in Washington, D.C. And so a lot of our policy advocacy is from Washington, D.C., talking with the White House, talking with members of Congress, every once in a while getting involved in litigation with some of our other healthcare legal partners, and certainly having a very robust relationship and ongoing dialogue with the U.S. Department of Health and Human Services. For example, just last month for Heritage Month, a small group of national AANHPI leaders did have a meeting with Secretary Becerra here in Washington, D.C. The other really important way we do our work is through our incredible and growing, fast-growing network of local partners across the country. In fact, our community network over just the last few years has grown from less than 90 local partners to, at the end of 2023, a network of over 250 partners in 43 states and the Pacific jurisdictions and territories. So what does that really mean? When you think about policy advocacy, and let's think about COVID. We knew, and all of you know really, really well, what the challenges were when COVID unfolded. It was access to care, it was access to vaccinations, but even those very few early days, it was access to critically important public health information in language and delivered by trusted partners, which are all the leaders who are joining us today. And we know early on that it was just very, very difficult to access care and get any of that information in language. We knew that. We heard from a lot of our community partners, and this is where the community voice is so important. And you could say, Julia, this is what was happening in Chicago. Or in Minneapolis, it was similar, but we also had this challenge, or maybe we created this solution. And so what we try to do is really engage with our local partners, hear what you're experiencing, hear what you're troubleshooting, what you're developing, right? Like Dr. Hong Liu, when we met earlier this year, you were explaining to me why and how MAHA began your food banking program. So we listen to that kind of input from all of our partners across the country. And then here in Washington, D.C., we try to advocate for improved policies and procedures, sometimes proposing different types of legislation, advising members of Congress, really advocating with HHS, increased level of resources, but trying to get very specific what kind of resources our communities need, and also giving them a better understanding of what the situation really looks like on the ground. Another example I'll use is so many of you have shared with us how important patient community navigators are. We know that. Now, at the federal level, there are federal grant opportunities, but so often that is very challenging and difficult for our local partners to be able to apply for a federal grant. And so what we do at the Health Forum is we will advocate for improved grant application processes. And also we will advocate for the opportunity, for example, where the Health Forum can serve as a national organization to apply for federal national resources, and then in partnership with you, subgrant those dollars out. You know, recently we've had a couple of, at least a couple of local organizations that have asked, you know, Juliet, if there's ever an opportunity to apply for a federal grant, we would love to be able to partner with you, both so that it's beneficial to the local community, but that it also increases our national visibility and voice, again, at the national and federal level. I know today is your second convening, and I applaud all of you. And the question that you'll continue to talk about is, you know, does it make sense to create a coalition? What would a coalition do? How is that beneficial to maybe the health forum? How is that beneficial to you? I think my easiest answer is, let's just think about our own personal individual experiences, whether it happened last week or maybe something happened 20 years ago, where maybe you felt very lonely and alone, or you didn't understand, how do I ask for help? Or how do I navigate, you know, a healthcare agency to try to get more assistance for someone in my family, my community, or my community organization? I know a lot of you are already experts in this space, but I do want to highlight our voice and our visibility is bigger. Our political voice is bigger when we can come together. That might be at the local regional level. That might be at the statewide level. What I do at the Health Forum, I cannot do that alone as just a national organization. We must do that in partnership with our local partners, because you have the experiences and you have the wisdom. I do really, one of my dreams would be to see lots of regional coalitions across the country, especially in the healthcare space. Our demographics, right? We know AANHPI communities, we are growing faster than ever. We are showing up in places where we never showed up before. I don't know if anybody from Nebraska, for example, is able to join us today, but just a couple years ago, I met the Karen Society of Nebraska, and they are an indigenous population, mostly from Southeast Asia. And we all know they deserve a voice. They deserve to be heard. And if all of us can mobilize around places like Nebraska, we also know, I hope, that their voice, their visibility, their impact, their resources will grow more quickly than maybe for the rest of us it took 10 or 20 years of advocacy. The Midwest specifically, I know you got a whole lot going on in Illinois and especially Chicago, but I think about Minnesota and Wisconsin and Indiana, Nebraska, Kansas, and you have such a powerful voice, and there is such a great need. I do think the benefit of a regional coalition is for leaders to share different experiences and solutions from one state to another. When it comes to Medicaid access, for example, I talk to leaders across the country, even outside of the AANHPI communities, and people will share ideas. Hey, this is what we tried in Texas. Why don't you give it a try in North Carolina? So I do think there's power in being a coalition. Now, that said, I also appreciate, I think everybody wears at least 10 different hats, and we are always busy. So I want to acknowledge that. Because of what you've done here in the Midwest, this is your second convening in less than a year. So please congratulate yourselves, right? And really honor and celebrate that. That's really important. So I think in our communities, we have a tendency to say, okay, what are our goals? What's our action plan? What are our outcomes? I would say for establishing a coalition, the biggest priority is to make sure you have political commitment amongst yourselves. And then from there, make a commitment that even without a formal agenda, that A, you want to stay connected, and B, you'll make the commitment to provide space and at least convene maybe 2 or 3 times a year. And you can have an informal dialogue. And I guarantee you, over time, organically, you will start to move into developing, a more coalition-driven agenda. But step one is that political commitment to want to have a coalition. And then step 2 is to make the commitment that you will make time for each other and meet with one another. Here at the Health Forum, I'm just such a big fan of all of you. I know a lot of you. I hope I get to know more of you. Check out our Voices Conference coming this fall in October. And George and Maha and everybody, thank you so much for allowing me to just share a few words. And again, congratulations for all that you're doing.
Thank you, Juliet. Let's give her a hand. I really appreciate you taking the time. I know you're a double or triple book already. And that word wisdom, we always want to see like direct result of our action. But I think the conversation actually is a result of a definitely good impact on our overall goal. So thank you so much. Okay, so very simple thought that I have as she was talking. There's the Voices Conference brings Ling and I attended a voice conference last year I believe in October. We met a lot of folks from different parts of the country, but there's a big convention right? But I think in the Midwest, I think we don't need a big convention to bring us together. But this kind of forum is a good stepping stone to such a big conference. And all of you, I believe, will be invited and welcome to the Voice Conference if you choose to. But it costs money, effort, and get there. But Dr. Hong Liu and I and Ling will talk about, hey, just a virtual get-together could be a beginning. This is why we're here today. And there's like 6 or 7 questions Dr. Hong Liu asked me. And I'll share that with you. Where's the budget for this? I don't know. Who's going to be in charge of this? I don't know. And how will we organize people? I don't know. There's so many questions. And then there's question. The fact that there's 80 people coming together wanting to hear about this is a big step. And the way I like to do things is, out of the 80, maybe I get 10 of you to have a more closed-door conversation. So I'm going to share a couple of my thoughts, and then we go into really quickly into the panel connection. The eventual goal of a coalition could be a more formal structure. By the definition, coalitions should have a well-structured plan and so on, but they require actually a lot of effort and resources and so on. What I'm thinking is we'll continue this goal of informal bring people together, and with Dr. Hong Liu's commitment to help Maha as a resource to bring people together, we could have this conversation informal first, and as Julia said, maybe we could put together a policy agenda of some sort for the Midwest when it comes to health and share that with Julia, and that becomes her template for representing us as a Midwest region. That may be one example. The second example could be, hey, we all come to Chicago, have a party at Dr. Hong Liu's second floor. But that requires a lot of effort. But we do have resource and space to bring people together in person. But it'll be whether there's a reason for you and a justification for you to travel. But we are here to offer that. And the third thing I want to say is we cannot do this alone for Maha. And we have a lot of organization within Illinois that we have worked together, but it's hard to bring them all together to form a coalition of some sort. But we do have representation from today's conversation, Ohio and Minnesota. So hopefully we're beginning to bring folks from outside of Chicago to have this conversation. With that, I'm going to invite let me see. Do I have Rachel?
Hi, George. I'm here.
Oh, hey, thank you. My first panel actually did include Julia Choi, but she couldn't stay for this whole thing. So we have Rachel and Allison. Allison, you all know because she was the co-MC last year. She's the director of grant management. She actually has a very good handle on what, as a grant writer, what is a organization as it presents its own capability. One of the capability actually is leadership. And I believe every organization has to show their leadership, not just beyond their own set of program and services. Is how they collaborate with other organizations. So you could actually, by being part of this coalition summit, you could put the check mark on it that you are showing leadership skill in your organization by participating and actually contribute to such a summit. So with that, I'm going to ask Allison to start with the conversation by sharing a little bit about yourself, your role in MAHA, and your thoughts on this whole idea of the Midwest Coalition. Allison?
Sure. Yeah, thank you so much, George. Thank you, everyone, for being here. It's wonderful to see you all. Really humbled to be in this space, and I certainly appreciate everyone's time. So my name is Allison Precht, and I am the Director of Grants Management at MAHA. And I kind of started in a program role, so I've transitioned into really just focused on grants. And I have had the honor of supporting MAHA's expansion through identifying and seeking funding opportunities at the local level, the state, county, and certainly federal level and regional level. I know Dr. Liu kind of spoke about our services already, but I have just some examples of the work that I've done in terms of grant writing for MAHA is first, we were funded in 2020 for a Chicago Department of Public Health Trauma-Informed Care Centers of Care initiative, and that was the first of its kind. We were one of 32 agencies, so it's been funded every year since, and we have had the honor of we're getting close to over $1.5 million in total, and it's really helped sustain our community mental health center and expand our services. So since we started receiving that funding, we were at a baseline of 50 unduplicated individual clients that receive services in our community mental health center. And we are now at over 400 clients and individual clients in our community mental health center who are receiving clinical mental health services, psychiatric services, case management, assessment, and then most recently, substance use disorder services. And then another large federal grant that we did also get in 2021 that I had the honor of supporting MAHA in is the SAMHSA, Substance Abuse and Mental Health Services Administration grant for $2 million. And this was for our community mental health center. And this was really to just to support the challenges with COVID, that COVID, impacted people accessing care, and to enhance the access of HIPAA compliant telehealth care. So, as everybody well knows, the impact that COVID had on the already existing barriers that there were for our community, for the AANHPI community, for MAHA's community, to access culturally and linguistically competent and appropriate care. So I'm really grateful. I've learned a lot throughout doing this work, and learned that there are lots of tricks and tools that can be utilized in terms of building capacity and building the agency's capacity. And I'm very grateful for Dr. Liu for all of her support, and Melissa and others at MAHA who have supported me in doing that work. And so I'm very grateful and excited to share and collaborate, in terms of coalition. The amount of funding that is dedicated for is allocated to the AANHPI community is 0.16% nationally. So it's a gross under funded, amount of resources that go to this community. And so I guess, from my knowledge and, experience in doing grant writing, and I also have served as a volunteer grant reviewer for the City of Chicago Department of Public Health. And so that has helped, develop my own capacity in terms of, knowing, kind of like approaches to take when writing grants to be successful in getting more funding to expand, not just to expand the reach, but, certainly to expand the reach that aligns with the agency's mission. And I think Maha has done a really wonderful work in doing that. And it would be a tremendous honor for me to support the coalition, in doing that, in terms of leveraging. I know there's been talk of leveraging expertise from different community agencies throughout the region and beyond. How can we help one another in terms of sharing tools, sharing knowledge and experience and skills to assess and assess what the needs are, assess what the mission is, and kind of like come up with shared goals and a plan. So
Great. Thanks. That's great. One of the projects that I worked on when I was at White House Initiative was to create a capacity building workshop for Asian American advocacy organization across the nation. And that's the biggest need in terms of smaller and lesser known, less resource organizations. I think one of the things that you and I and Dr. Hong talk about is MAHA's willingness to share best practice in this space. And perhaps even as, I don't know, this is a goal, attainable goal, that we could get grants for this region, where MAHA lead the conversation because our experience and actually implementation we've done across the Midwest. Those are kind of eventual goal of what we want to do. So thank you. Skip that thought for a second. We're going to have couple more minutes to exchange ideas. Rachel, thank you so much. I guess you're the rock star in HSS, huh?
He was exaggerating, I think. But yes,
well, I think you're
so
overeducated with all those degrees myself, but could share a little bit more about what you do at the office and kind of your thoughts on what we talked about so far. I know you and I have exchanged some ideas, and Dr. Jung Ling, I just let you know, I created a document and framework for a possible coalition, and most of the stuff come from AI. So anyway, conversation. Okay, Rachel.
yes, thank you so much, Maha, for inviting me, the regional director, Michael Kavanarji, who you all heard from earlier today, and just the Department of Health and Human Services to your virtual summit. And I want to echo the congratulations that we've heard earlier for your contributions to Chicagoland, Chinatown, and just the amazing work that you all have been doing these last few decades, for the last over 20 years now. So. My name is Rachel Nguyen. I am working public health policy with the regional director, Kavanarji, for HHS here in Region 5. And so that covers Illinois, of course, but Indiana, Michigan, Minnesota, Ohio, Wisconsin, as well as 34 sovereign tribal nations. And we're just going through our tribal consultations right now, so that's very exciting. I'm also part of the initiative as well, the White House Initiative for Asian Americans, Native Hawaiian, and Pacific Islanders in our regional network. So I wanted to share just a bit about HHS. I think many folks here are very, very familiar and have gone through the grant process, which I commend you all for. But just for those who are wondering, what exactly it is that we do, it's the Department of Health and Human Services is the principal agency for protecting the health of Americans and providing essential services. And so that mission is really about providing effective health and human services, but also fostering advances in the sciences that are underlying the medicine, the public health, and the social services. And so there's 12 operating divisions that make up the HHS, many of which you've heard of, I'm sure, the FDA, CDC, the NIH. We heard a lot of those during COVID, but also a few of the other divisions that were mentioned in this call, like SAMHSA, the Substance Abuse and Mental Health Services Administration, or the Administration for Children and Families that provides a lot of early childcare support. And then our team, as part of the Office of the Secretary, work closely with Secretary Becerra to just promote the Secretary's and the administration's HHS goals in the region. We are part of the Intergovernmental and External Affairs team. And so that really just means that in such a humongous department, you know, I think we have 20% of the federal budget at HHS. We are really here to just serve as the front door in our community in the Midwest. And so liaising with state, local government officials or tribal governments, but also community leaders and community-based organizations like MAHA.
孙大夫啊，你好，你好，你现在方便吗？我现在在。
Sorry about that.
No problem. Yeah, and so as part of that work, we really get to be out in the community often to engage with providers, nonprofits, local government levels, and the idea is to really just uplift health access and health equity, given the historical inequities across our community and many other communities, and take what we hear in those listening sessions and bring them back to the federal level. And so, yeah, that's a bit about what we do. And in my personal experience in this space, the RD shared a bit about my background, but yeah, I'm a transplant to the Midwest. I'm actually born and raised in Texas, but have been very involved with the universities, Asian American initiatives, as well as part of the associate board for the Chinese Mutual Aid Association in Argyle in the Uptown neighborhood. And so, yeah, I've really seen kind of what the reality is for our community across the Midwest. Juliet mentioned Karen people earlier, and I had the privilege of working with a largely Hmong and Karen, which is a Burmese minority in St. Paul over the summer in senior care and home care. And when we talk about equitable access, you know, there was only one person on our team that spoke the language, and that person was running around trying to make sure that their Medicaid application was renewed. Family members going to the hospital, they have to come in and translate. At home, there's often not broadband access or even owning a smartphone or computer device to apply for applications. And so when we talk about access, we really need to start disaggregating the data across Asian American, Native Hawaiian, Pacific Islanders, and think, how do we reach each specific group and meet them where they are? And it takes dialogue and numbers to advocate and create change. And so we're very excited to partner with MAHA and other organizations that are making that change happen, because we know it's slow and we know it's difficult, but there's progress.
Great, fantastic. And just so happened that our proposed region is your region, Great Lakes and all the different states. I think we try to expand a little bit more than what typical known as Region 5 so I think we'll have a great reason for continue this dialogue on what might be possible. Don't you think so? Yeah, we also know we're good friends, all of us are good friends with Dennis and CMAA. So just tell Dennis to behave himself. Huh?
That's the message.
Allison, what do you think in terms of, in your experience working with HSS, are there things that we could do more or less? Not only from our perspective, since we got Rachel, but also from other Asian American organizations to give her some feedback.
Yeah, thank you, George. I mean, in terms of, I think just using whatever tools there are in terms of communication, signing up, being as engaged as possible. So just to be aware of the resources that exist. And I can, give an example of, Dr. Lewis training me on a platform, right? And then while during the training, we happened to notice a funding opportunity that that aligns with very much with our with the agency's mission. So I think a lot of times, the resources, just having signing up for whatever listservs there are, whatever trainings there are, capacity building opportunities there are, to increase, the capacity of the staff. As everybody is aware of, that we're certainly a nonprofit. Everybody wears multiple hats, and so I think the more that internal staff team can be aware of, kind of like the process of, how we can go about advocating for more funding and with in direct contact with HHS. And how we can, kind of just be more on your radar, the better. So those are my initial thoughts.
Good. Rachel, would it be okay if I share your contact information for the participant?
Yeah, no problem, George. And I appreciate the comments too, Allison. We totally agree. There are so many resources, even within the federal government for federal government employees, let alone for grant applicants as well. And so that's been one of my big initiatives this year, is working on kind of a grants 101. And of course, it's been done. There's so an overwhelming amount of resources online to navigate federal grants. But we're trying to partner with local congressmen and women in our district. And really, just the other week, we were at a library in the suburbs and just meeting with community.
Are you doing it in language? Are you doing it in English?
That one was in English, but that's a really great point, George, and how we can bring
what possible coalition can do for you might be the fact that we have different resources across the Midwest that might have access to in-language translation that could actually you could partner with, right? So
yeah, that's a great suggestion. So I totally agree that the communication and the awareness of the resources that are out there, and just finding funding opportunities that are relevant, because a lot of the organizations in our region are already doing that work every day and are totally eligible or great candidates for.
Yeah, in fact, MAHA has a lot of capability in different languages. Let's pitch MAHA as your collaborator too, of course. Yeah, thank you so much. Thank you so much, Allison and Rachel, for taking the time. Welcome to stay and jump in further conversation if your schedule permits. So next, I want to turn over to my good friend, Ansar. Are you still here? Yes, you are. I know you are.
I'm still here.
Okay. Well, take it away. You have a panel, and I'll give you 20 minutes, 25 minutes before we wrap up.
Yeah. So I'm excited. Our panel's on from perspectives from community advocacy leaders on our dream of this AANHPI Health Services Coalition. So I'm very happy to have Pauline Koo from Koo Consulting Inc., Cora Muniz, CEO of the Ohio Asian American Health Coalition, and Melissa Wee, Mental Health Clinic Director at MAHA. So, I see Pauline Koo. Do you want to, say a few things about, some of the services and programs that your organization provides in the health services sector?
So good afternoon, everyone. My name is Pauline Koo. I founded Koo Consulting in 2020 after spending more than 20 years in public and community engagement, marketing, communications, and DEI coaching. So we help organizations step into diverse spaces and better connect and communicate with multicultural audiences. We also help under-resourced communities a lot of Asian populations from the immigrant and refugee populations to ensure they are also connected to resources, and we help them break down barriers to access. Some of our health projects include our mental health awareness project with the Ramsey County. We work with specific Asian communities to help dispel the myth around mental health, because what you don't see is maybe something they don't believe they exist. So we also have a project with Department of Health on bringing awareness about COVID-19, and we work with members of the Karen and Karenni communities. In fact, right now, as we speak, I'm organizing to help one of the local film producers to bring awareness about loss and hope in the Karenni community, and also hosting a panel on educating people about the plight, working with somebody who spent 12 years of his life in the Thai refugee camp. We also have a project on 988 suicide prevention resources for Minnesota, where we help educate people about receiving confidential help. And we also have a Department of Public Safety help on traffic safety. What does it mean when you get stopped by the police? What does it mean when you have anxiety around approaching, and talking to law enforcement? And I can go on, but another project that we have, it's also on breast and cervical cancer screenings for the state of Minnesota, for the Department of Health. And we bring illustrations to educate to everyone, try to help them understand that cancer is preventable. Cancer doesn't mean death. So we illustrate, like, this is one cancer cell, this is millions of cancer cells. What does screening mean? So I'm a first-generation self-funded college student, a Malaysian Chinese immigrant. I received the 2023 Outstanding Immigrant Business Award for Minnesota last year. Although we are a for-profit organization, our work is centered around community organization. And I'm also an advocate for a lot of Asian events. I volunteered a lot, sat in the hot sun. I'm also a member of the Asian Resilience Business Network group, and love to be here and have conversations about how we can collaborate. Thank you.
Thank you. Yeah, the work never ends.
Right.
It's like a never ending. We always need more people. Same for you, Cora. Love to hear a little bit about you and your organization, some of the things that you do.
Thank you, Anne, and thank you, George, for inviting us again. What a pleasure to really be listening to everyone and to learn from everyone. We are a coalition, a consortium, or an alliance of 8 grassroots community organizations in the state of Ohio. It was founded in 2005, but really the idea of getting together, just like we are now, thinking of this regional coalition, it started in 2002, and it took a couple of years, and we started with conferences, state conferences, and in Columbus, in Cleveland, Dayton, and different parts of the state. And finally, we were able to get funding and was able to start this coalition. We got a Kellogg Foundation funds for capacity building. Well, our mission is just like all our missions together here, right? We're talking about improving access to healthcare. We're talking about how important it is for us to address the health disparities and the social disparities and social determinants of health that is really leading to poor health outcomes. So we have to pay attention to housing and education, etc. So our vision is to really improve the quality of life of Ohio Asian Americans and Pacific Islanders. We are working in Central Ohio with 16 Asian subgroups, and there's more, right? And there's more. Yeah, we have Karen in the north, and we have Hmong as well. And then we have Bhutanese and Nepali. And in addition to the Asian Indian, which is the largest Asian group in Ohio, in 2000 24 information from our Health Policy Institute, Asian Indian, and then the Chinese and Filipino. And a few years ago, it was the Chinese as the largest, and I think Chinese is still the largest, nationally, but in Ohio. So our needs are different depending on the Asian subgroups, right?
Yeah.
There are commonalities, but we have to really be mindful of the fact that although we are Asians, we're not homogeneous.
No.
And that there are, in fact, unique challenges, unique needs based on each subgroups. The languages are different, right? We have, in Ohio, right now we have 293,387 Asian Americans, 73% increase from 2000. And this is across the country.
Oh my God. Wow.
And the reason being that we have the Bhutanese Nepali refugees still coming in and just increasing the number. Okay, we will forever be small in number, right? We will never be like the majority population, but yet we have to lift our voices and make it loud to say that we need to understand our communities and we need to look at our data in a disaggregated way.
Yes,
If we
absolutely.
put them all together in aggregated way,
Yeah.
all falls into the mean, then we perpetuate that everything is fine with Asians, no health problems, health exemplar, far from the truth, right? We have such unique challenges. Socioeconomically, we are in a continuum. In fact, a large number are below the poverty line. But when you think of Asians, it's because, this myth that everyone's okay, highly educated.
Yeah, that the model minority myth.
The model
It
minority
really hurts us. Yeah.
And we don't want that, right? We don't want that. So
No.
we are facing those challenges.
Wow, thank you, Cora. And I we'll get back to all this. Melissa, I want you to tell everybody a little bit about what are some of our programs.
Hi, everyone. Thank you. My name is Melissa Wee. I'm the Mental Health Clinical Director at Midwest Asian Health Association. I started with working as a mental health counselor. Back in 2016, I joined MAHA. And at that time, we were small. We only have 10 clients because at that time, mental health stigma is still very, it's still like something that is hard for the community to accept that I'm seeing a counselor. So we do a lot of advocating, and then we do a lot of educational workshop, and then helping the community to understand it is not a bad thing to meet with a counselor. And then we also use other approaches through like case management, and then gradually communicating to them about mental health. With the SAMHSA grant that Alison mentioned before, we were able to be more creative, and then working with our massage school, and then to provide 15 minutes free massage and 15 minutes free consultation for the community. And then we did that for 2 years, and then the community really liked it. And then there's still people asking like if we going to do it again and when we are going to do it again. So so definitely we are expanding, and then started with like 1.5 therapists, and then now we have 4 therapists, and which is a very big improvement. And then also like every year we also accepting clinical interns, training them, and then like hoping that they will also like continue staying to fulfill the needs of the community of Asian American. And then with the COVID, we're not just like serving the community in the Chinatown area, but we're also serving Asian population in the suburban area through telehealth. And then some of them even like drive down to meet in person as well.
Thank you so much, Melissa. So I can tell you some of our challenges, to Cora's point and Pauline and Melissa's, that in the mental health area is actually having mental health professionals who either understand or come from the community and hopefully also may speak some of the languages. So it's an extreme challenge. So I think we can see that there is a benefit for such a coalition. What I really want to get into with you, smart women, is, what are your thoughts on areas of collaboration? Like, how do we get this done? Because I know George is kind of like, how do we get this done? Like, we really want to understand, like, what are some ideas of sharing best practices? And since I have such powerhouses in Minnesota and Ohio, right? How can we work together? What are some of your thoughts on how we can actually maybe practically do this? What kind of information should we share? I don't know who wants to start first.
I can go
I
first.
have.
Oh, go ahead. Go ahead.
I just have a list, and I can, I wrote it down with, potential partnership, because there's power in being together. Our coalition statewide with 8 member organizations. Our executive director is here, Dr. Antu Tai. And so there's a list of things that we can potentially partner with and really yield good results. Number one for me is legislative advocacy. In Ohio, we need a commission for AANHPI. We don't have one. We had an advisory council to the governor, but this present governor decided not to issue an executive director, so that council does not exist. We want to learn from other members, like I think Michigan has a commission. So legislative advocacy. Okay. Our mental health projects, we all have mental health projects, and we've talked about we've done mental health assessment statewide up to close to 300 participants, thanks to the support from our Ohio Mental Health and Addiction Services. And I know Dr. Malaika Brewer, who is our funder, is here, and I appreciate their support. Mental health projects, and particularly mental health first aid trainings, because now they have in Asian languages, just a few Asian languages. But more importantly, besides being curriculum, evidence-based curriculum translated in Asian languages, we should have facilitators who are Asians.
Yes.
And at least in Ohio, we have, I can count with one hand of Asians, because the trainers are all, at least in Ohio, not Asians. When we have facilitators who are Asians, clearly, you connect, you engage, and we'll be able to have, better outcome. And then sharing translated materials. We don't have to reinvent the wheel. Yeah. We have right now, again, funding from OMAS in Ohio. We're translating our resource guide in 7 languages. And we've done translations of COVID information. But, I know everyone else have done that in a coalition, regional coalition. If we can share that, we don't have to duplicate resources or expense. We can just share, because we have a common goal, right? Mm-hmm. And lastly, partnership with academic institutions.
Yes.
Right now, for research, we need data. We need empirical information. Right now, the coalition is involved in 2 mental health research projects through the Ohio State University.
Nice.
And so we are now looking at that data and hopefully have more, so that we can look at the issues of our Asian ethnic subgroups and then understand them better and plan for their needs. Thank you, Anne.
Thank you so much, Cora. Pauline?
So thank you for the information. I tend to look at it from a different angle as well. So I look at it as these are people we're trying to affect, impact, change their mindsets, create areas of trust, create building relationships, create safe spaces so they can come and get the resources and access them without fear. So yes, we have policies. Yes, we have engagement. Yes, we have translated materials, but getting them to come and be able to say, I'm going to MAHA, I'm going to talk to people from Ku Consulting, I'm going to do XYZ because I know they understand who I am. I've seen people representing my identity talking about how they overcome a difficult situation, talking about how they overcome not committing suicide, talking about how they went and actually got a COVID-19 vaccination, and talking about how they did not let their cultural beliefs prevent them from getting cancer screening. So I think it would be extremely and critical, very helpful, because I do this kind of a lot by myself, because I do table at events and try to talk to people one-on-one and build a trust and say, look, this is where I come from, where I had to go and do XYZ by myself, feeling scared, unable to give feedback because I do not like state agencies. I don't know what they're going to do. What are you putting in my bodies? And however, I think the coalition should include how each of us get people represented from those communities to come and speak about their experiences, because we require changing mindsets. Changing mindsets means not abandoning their cultural beliefs, not abandoning their traditional values, but looking at a way to understand that we are giving them a safe space to be their authentic selves, to advocate not just for themselves, but their families and also their communities. And to show up as an advocate for themselves in their own communities, but we need to change and transform the mindset of this community. So I think there are 350,000 agents in Minnesota. Yes, the largest is Hmong, and then Southeast Asian Indians, and then our Chinese. But now, as Cora has mentioned, there's Bhutanese, Karen, Karini, and there are many more that, and 80% of the Karini and Karen community members are living in poverty.
Wow.
I've tried talking to them. I offered them gift cards of $50 to talk to me about COVID-19. Why wouldn't they get vaccinated, right? So some of the reasons are, I don't want to go to the hospital if I get sick. If I get hospitalized, they're going to give me cold water to drink. As you know, as Asians, we believe in drinking warm water. I was like, whoa, as basic as that. Wow. We never think about that. That's such a simple barrier that we see, but we never would think about that we can say, yes, you can be brave enough and ask for warm water. So so those are the things I think we can collaborate more on the human side, because people like MAHA and a lot of great organizations like Cora, I am sure you are doing the advocacy at Department of Health, because I work with Human Services too. You're doing a lot of advocacy work, but I'm really passionate and grounded and rooted in ensuring the communities that we want to impact can come forward to receive this help. Thank you.
Melissa, I don't know if you had any comments.
Yeah, I agree with both Akora and Poland, and then definitely like for this population to speak out about the experience, sometimes it's difficult. And then the coalition maybe it can also like thinking of ways that make them feel comfortable, like how to share the stories in a creative way, and then also like a way that helping them to feel comfortable. And then also about data, because data about Asian American and yeah, this population is very little. And then definitely the coalitions like will be able to work together on that as well. And then also to share about what are the things that they notice, like 9A, it's everyone's get trained the same way, and then like the experience that maybe in this state is different from other states, and then maybe having that communications, then we'll be able to show to the people that, okay, this might be some things that need to change or like need to adjust to.
Great. Well, thank you guys so much. I think
And if I
yeah.
may just quickly give an example to support what Pauline has just said, which is really, I agree. We have a program that's coming up the end of June, and we call it Mental Health Lived Experiences, Community Voices, Hope, and Healing. And we invited individuals who have experienced mental health challenges themselves. Because Melissa mentioned about the stigma. If we don't talk about it, and that we won't be able to, it really becomes a barrier to treatment and to reaching out to others who can help you. So we invited a panel from different Asian groups who are really courageous, because they'll talk about the experience of losing a child to suicide, for example, or having a family member. So that's one thing that we're doing the end of this month, and it's again through funding from OMAS.
That's awesome. I think we're just about out of time, so I'm gonna thank you guys so much. You've given us a lot of food for thought, both from legislative policy, studies, as well as grassroots. So thank you very much. George, I'm going to turn it back to you. You're on mute.
Thanks, Ann. That's the only way to shut me up. Mute. Thank you so much, everyone, for your contribution, Cara, Melissa, Pauline. It's great to have folks from all, well, at least 3 states right now. So we're looking to get more input, and hopefully we could bring more people from your state into this conversation next time. But there's we got about 7 minutes left. I'd like to do 3 things. One, most important for George, I'd like everybody to turn on the camera. If I ask you to turn on camera, I have a commercial smile. I call it a commercial smile. It's like you're on TV kind of smile. All right?
So turn on your camera.
Turn on your camera.
Turn it on.
And turn it on. And then practice a commercial smile. Pretend you're like a model for the toothpaste. Okay, so somebody's going to do a screen capture, but I'm going to take my camera and do a picture of everybody. But again, we'll be on TV. So this is just George's social media post. All right, ready? 1. Well, I got 4 pages here. Oh, amazing. There's still 65 people left. Okay, Cindy Chen, camera. No, I know some of you guys are shy. Justin Hong. All right. I couldn't get, I have a whole page of no pick camera. Okay. So next I want to, I know sometimes these conferences are pretty much one way. You listen to the speakers, but I want to give a few minutes to anyone have some thoughts on this whole topic, especially those who have ideas. And more importantly, I don't need people with ideas. I got plenty of those. I need people with willingness to participate and help us launch and put this together. So raise your hands. Dragon TV, Dragon Eagle TV, your hand is raised. You're recognized.
Okay, George, you got this time you got that right. Okay, audience, everyone, thank you very much for participating, and nice meeting everyone here. Just very quick introduction. My name is Lisa Gray, and the founder and the executive producer for Dragon Eagle TV and APIA News Network, which is a community-based ethnic media platform. So we aimed to bridge communities and advocate diversity inclusion and to be the voice of AAPI community. I should say now the AANHPI community. We're so honored to be the partner with MAHA. Just recently, we started a program on mental health, and which is very successful. We would love to continue that partnership, and because MAHA is such a wonderful organization, and we definitely can provide marketing and community outreach for the proposed, they call it Middle West in a AANHPI Health Coalition. So we definitely would love to partner with all of you guys and to elevate and promote and elevate our voices and promote all your efforts. But thank you very much, George, for giving me the opportunity. And again, we love MAHA.
No, thanks for being part of the partner to MAHA and me, actually. Actually, Lisa and I have been working together from the Asian American Executive Network perspective. And we actually are talking about having...
The other thing I wanted to announce here, Georgia, if you may, and we're starting, Georgia and I, we're going to start a talk show. So I really want people to pay attention on that.
Wait, Lisa, hold on. We have to negotiate my contract first. And you have to talk to my manager, Ann Saw, okay?
Wow, you have an agent. Okay.
I have a lawyer as my manager, so...
All we want to do is elevate our voices to promote...
Okay, Lisa, we can certainly talk about that. What Lisa is talking about is for us to provide a platform and forum on a sort of like talk show format. For example, I can invite Cora to talk about this same topic in a more relaxed and more deep dive on the different issues associated with it. That's an example of something we could do.
In addition, I'm sorry, just one sentence. I want to thank Dr. Liu Hong, and she's wonderful, very capable lady, and other lady, and their president, Junlin, and I've been working with them for quite some time. I just want to recognize them. Thank you so much for
Thank you, Lisa. I also, Lilia, I can't pronounce your last name, Lilia.
Oh, thank you. It's Lilia Guevara. Thank you so much for allowing me to speak. I promise I'll be fast. Well, I represent the McKinley Park community, and we noticed that 35% of the population is Asian, and 35% is Hispanic, and the other 35 is white. So we have seen the need, the Hispanic community, but also in the Asian community about mental health. We, through the Resurrection Project, hosted in the library some mental health first aid workshops for the community, and it was very well responded. We usually had like 15 to 20 participants each session. So that there is a stigma, and I totally agree with you guys, you know, with everything that you're doing, the coalitions, and then I just wish it will be those focus groups, like focusing, like you were saying, like, how do you feel like a parent, you know, losing somebody to suicide, or how about, you know, how do you feel as a parent who has a special needs kid? You know, all those focus groups are very, very important, and I wish, you know, it would be more funding or opportunities to keep promoting that. It's very important. So thank you so much.
What town city are you from?
Chicago.
Okay, so you do know, maybe you don't know, that every MAHA program is open to all community members, not just Asian American.
Oh, well, thank you.
So make sure you get connected with Melissa on the mental health program. In fact, we have clients who are not Asian American. In a food pantry, is open to all in the zip code. So there's some clarification for you. And again, you are welcome to join the coalition. We don't have to have Asian American organizations. So we're open to. Okay. So
thank you.
Stay connected. I saw somebody else raise their hand. Jolene, didn't you raise your hand, or you just cheering?
Jolene, you muted.
I was cheering for all the discussions and sharing of what the services that they are experiencing. I
Oh, I thought
appreciate
you were
all the
cheering me
information.
on. I thought you were
Thank
cheering
you.
me on. All right. Any other? So I want to provide a forum for you to have contribution, and I might have scared you off that you don't just come with idea, but come with roll up your sleeve and do some work. But I'm open to ideas now. But one more ideas?
George,
Yes.
this
Yeah. Who's
is
talking? Sorry.
this is Mary D from the Asian Services in Action.
Oh, Mary D.
I am participating in place of my manager.
Okay.
What I've noticed in this panel of the people who are participating is that there are no representatives from, and this is not a criticism, no representatives from the people from Myanmar,
Yes.
from say the Nepali community,
Yes.
and Burmese, the
It
Karen.
is 25 ethnicity in a community, and you know what? They're all welcome. I just George haven't got a hold of them, so
Right.
I'll be happy to make the connection for you and invite them to join our conversation. So remember, this is not the only conversation we have. Like Cora said, it took them 2 years to do just Ohio. Can you imagine how long it takes to do Midwest? So we're going to have more conversation. The next step, I think I would say next step, is I'm going to go through the registration list, and then we did ask the questions on who registered for the workshop are interested in part of the coalition. Okay, and we will invite those people only to maybe a closed conversation, because I like to have open conversation, but sometimes you have to take a deeper dive with people who are interested and willing to roll up their sleeve to do some work. So again, every community is welcome, everyone's welcome, but don't come and listen. Come and participate. That's all I ask for. Okay. And actually, with that, again, with respect to your time, I really appreciate you staying almost to the end. And the end is here. And I'm going to offer the opportunity for Dr. Hong Lu to make some closing remarks.
Thank you so much. We still have most people here. Thank you for attending and staying with us for the last 1.5 hour. I hope this summit is beneficial to your work and to your interest. Based on a philanthropy study, I think we talked about this last year, and also Allison mentioned about our community is really underfunded. According to a study, for every $100 awarded by the foundations in this country, only 20 cents go to AANHPI communities, which is about 0.2%. But our population is about 7% of the US population. So we really, it's important for us to work together to advocate for our needs and ask for more funding resources and then share data to emphasize the needs of our community, especially regarding mental health. And we talked about a lot. We will continue the dialogue and then put a team together to discuss the possibility of building capacity for Midwest AANHPI Community Health Coalition. So I like to thank our VIP group speakers, panelists, moderators, George Moy and Ansho. You did a great job. And the Maha's staff, Jessica Chen, Alison, Melissa as panelists, Justin and Cindy Chen for helping with the event. And then also like to thank Lisa Gray, Longyin Dragon Eagle TV to broadcast this summit, so we can reach more audience who cannot make this event. Again, thank you all again for being here with us. This will conclude our summit. but of course our work is not done. Please stay in touch moving forward. Have a great rest of the day. Thank you.
Thank you, Dr. Hong Liu. And you will be maybe getting sick of getting email from me to continue conversations. Thank you. Have a wonderful rest of the day.